Have you ever gotten an MRI, looked at the results and thought, well, that explains my pain, but then your doctor tells you that what the scan shows doesn't actually match your symptoms? Confused, huh? You're not alone. Hi, I'm Amin Ibrahim, a physical therapist, and in today's video, we are diving deep into the truth about MRIs. They don't always tell the full story, and that's critical to understand if you're dealing with pain. Let's start with the basics. MRI stands for magnetic resonance imaging. It's a powerful tool that gives us detailed pictures of the body's soft tissues, muscles, ligaments, cartilage, discs, and even inflammation. It's incredibly valuable for identifying ligament tears, tumors, infections, and the structural abnormalities. But here's the catch. Just because something looks abnormal on the scan doesn't mean it's causing pain. This is the part that surprises people the most. Did you know that the studies have shown over 60% of people over 40 with no back pain at all have bulging discs on MRI, and meniscal tears in the knee are commonly seen in pain-free adults. So, if MRIs show things even when you're not in pain, what does that say about how useful they are for diagnosing pain? Think of it like this. A car can have scratches, dents, or wear and tear, but still drive perfectly. The body is the same. MRIs can pick up normal aging changes that aren't actually the cause of your symptoms. Let's go through a few examples. Disc bulges, often found in people with no back pain. Degenerative disc disease, a scary name but it's basically like wrinkles in your spine, not always painful. Rotator cuff tears, 20 to 30% of people over 60 have them without shoulder pain. Meniscal tears, common in active or older adults and don't always require surgery. So again, findings doesn't equal pain. What matters is how your body functions and how you move. One study published in the New England Journal of Medicine scanned hundreds of people without back pain and found disc issues in the majority. Here's a quick example from my own clinic. A patient came in with MRI-proven disc herniation, sharp back pain, couldn't bend, but with movement-based treatment, within 3 weeks, they were pain-free. Did we fix the disc? No, it didn't need fixing. We treated the way their body moved and the surrounding muscle tension. Another patient had no MRI findings at all, but had debilitating pain from poor movement patterns, overcompensation, and stress. This tells us imaging doesn't always guide treatment, functional assessment does. Pain is complex. It can come from inflammation, poor movement mechanics, muscle imbalances, nerve sensitivity, and even stress and fear of movement. Sometimes pain is about tissue damage, but often it's about sensitivity, your body's alarm system being overactive. We call this central sensitization, the nervous system interpreting normal signals as threats. The MRI can't measure that, but a skilled PT can often identify it through functional testing. When you come to a physical therapist, here's what we assess instead of just imaging: joint mobility, muscle activation, movement patterns, balance, posture and gait, and functional ability like squatting, lifting, and walking. We want to know, how does your body move, and how can we restore optimal function? We use imaging when it's necessary, especially to rule out red flags, but we don't let it control the whole story. We focus on what you can do, not just what the machine says about you. If you've had an MRI and the results look scary, don't panic. Ask these questions. Do the findings actually match my symptoms? What are my functional limitations? Can I improve with rehab first? Remember, your MRI is a tool, not a sentence. You're not your scan. Pain is real, but so is recovery, and imaging is just one piece of the puzzle. If this video helped clear things up, please like, subscribe, and share it with someone who's feeling discouraged by their MRI report. And let me know in the comments, what did your MRI say, and what did your body say? Let's talk about it. Thanks for watching, and I'll see you in the next video.